issues, so that's great. Lovely. So welcome everybody. As I said, thank you so much for joining us today. This is the first in a series of 4 webinars that we're running in the next few weeks, entitled CEP Innovate Health. And the purpose of this really is just to provide a bit of an introduction to innovation in the context of healthcare and specifically in the context of the NHS. And hopefully you'll find it to be inspiring. If you haven't sort of got an innovation or an innovative idea, hopefully it will inspire you to come up with one and develop one. And really, we just want to offer you a sort of an insight into how broad innovation can be, the different types of it. And how you can really develop your idea in terms of sort of business planning, something called Lean Canvas, which we'll be looking at in a couple of weeks' time, and also how you can articulate your idea or pitch your idea to others. So just a few little bits of housekeeping. As I mentioned, we are recording this session. You're more than welcome to put your cameras on if you'd like. If you prefer not to, that's absolutely fine. Just bear in mind, if you do have your camera on, it may appear in your face may appear in the recording. We would just ask that you sort of remain on mute unless you are asking a question or have a comment or an idea to share. And we do hope this will be a sort of interactive session, and each session will be, so there will be opportunities to ask questions. There will be opportunities to share your ideas as well. And the next session will be next Thursday, so it will lead on from this one. But yes, so feel free to raise your hand if you have a question, put something in the chat. The team that's here with me will be monitoring that as well. So just to get started then, if my slides work. So just to do a bit of an introduction. So my name's Jenny Petty and I work for the NHS Clinical Entrepreneur Programme, which is part of Anglia Ruskin University. I'm a programme support officer on the team, so it's great to meet you all virtually. I'll just pass over to Tamsin, who is with us, for a brief introduction. Thank you.
Hi, my name's Tamsin Holland-Brown and I work as a paediatrician in Cambridge. I'm now the co-clinical lead for the NHS Clinical Entrepreneur Programme. I've got a history of being on the programme myself a few years ago with both a device and an app. And great to be here. Thanks, Jenny.
Thank you, Tamsin. Polly, if you could give an introduction.
Hello, everyone. I'm Polly Sullivan. I'm National Programme Lead for the Clinical Entrepreneur Programme that's delivered by Anglia Ruskin University. I have worked on the programme since it began in 2016, but I've been working on innovation programmes in a learning development capacity or business support capacity for startups for about 13 or 14 years now. So thank you for joining us. You're all very welcome.
Thanks, Polly. Lucy?
Evening, everybody. My name's Lucy Dentis. So I'm Programme Manager for the NHS Clinical Entrepreneur Programme, and I work alongside the rest of the team at ARU. I'm also responsible for the Patient Entrepreneur Programme and Dementia Innovators Programme. So we support patients who are developing innovations and also work with the Alzheimer's Society. So welcome to this session, and we hope you find it really interesting. Over to you, Jenny.
Thank you. So as mentioned, we're part of the NHS Clinical Entrepreneur Programme, and I think quite a number of people on this call might be from Anglia Ruskin University, so we're part of that university. I think some of you are students from there. But Polly, if you're happy just to give a bit of an overview of the programme and what we do, that'd be great.
Yeah, I've just added to the chat, so you're all aware the handbook for the programme, for this short programme, so it'll give you some more details on what will be delivered. So the Clinical Entrepreneur Programme has been running since 2016. It was initially designed as a workforce development programme for junior doctors, and over the last 9 years now, it's grown to include all clinical professionals working in the NHS, as well as all professional staff. As I said, it's a workforce development programme, and it was designed to enable NHS staff to develop innovations and startups and commercial ideas alongside their role in the NHS. We do also accept students onto the programme that have a direct route into the NHS. So that includes medical students, nursing students, pharmacy students, etc. So as it says on this slide, we are supporting NHS staff to deliver innovations that directly benefit the NHS and the workforce. And they are, if you check out our website, those ideas are very diverse and encompass all sorts of different areas. Yeah, I don't know if anyone else, I've rambled on a bit there. I don't know if anyone else has got anything to add that I might have missed.
Jump in there. So as I mentioned before, the programme also caters to patients now and dementia innovators. So as Polly said, we started in 2016, but we've really expanded out a lot, and we understand the importance of the patient voice and also those innovators that are working in dementia innovations as well. So we aim to take the best ideas and really propel them forward to the benefit of patients as well. So yeah, back over to you guys.
Also to add, which Lucy reminded me of, we are funded by NHS England, but we also incorporate all of the home nations in the UK. So we've got cohorts in Wales, Scotland, Northern Ireland, and the Republic of Ireland. And there has been a programme developed in Australia as well that we help to begin. We also deliver lots of other training to other cohorts. So we deliver training to medical students, we deliver training to community projects and social enterprises around innovation. And we've also developed some leadership training for what was Health Education England, but now it's just NHS England. So we've got amongst the team, we've got a good skill set in delivering this sort of thing.
Thank you, Polly and Lucy. Lovely. Yeah, as I said before, if anyone has any questions, please feel free to just pop them in the chat, or towards the end, there'll be the opportunity to raise your hand to ask any. So yeah, so the purpose of this particular session is to just give a bit of an introduction to what innovation is, and specifically in the context of healthcare. So to go back to sort of real basics, looking at a sort of dictionary definition of what innovation is, it says it's the creating and use of new ideas or methods, or the introduction of new ideas, methods, or things. So innovation is closely associated with, newness, novelty, creation, implementation, use, and also it can be an idea, it can be a method, it can be a thing. And if we consider the sort of types of innovation, you might be joining this with, very limited experience. You might not be an innovator yourself, and you might have a preconceived idea, perhaps, that innovation is a sort of a tangible, a physical thing, like a medical device. And it can be, and we do have many innovators who have such devices, products on their programme. But it could also be a process. So it could be something that, an innovative process that makes things more streamlined, has better outcomes. Or it could be a service. So there could be many components to the innovation, which packaged together is a service that's delivered to patients. And when reading up on innovation, you might hear it described in different ways. So you might hear of sort of incremental innovation, and this could be sort of small gradual improvements to an existing product or process or service. You might hear of disruptive innovation, and this is where there's a real focus on sort of disruption to an existing market. So it might be specifically that an innovator, a startup, a small business with very few resources, joins an existing market, sort of moves up market and challenges those sort of long-standing, more established businesses that are within that. You might also hear of radical innovation, and this is really a sort of a major breakthrough. And it could be something that sort of completely transforms, completely changes an industry. Perhaps it creates a whole new market. Perhaps it creates a whole new set of products or ways of doing things. And you might hear other descriptive words as well. So if you're reading up on this, just look out for that. There are different types of innovation, and you can classify it in different ways. And in terms of what an innovator looks like, well, an innovator could be anybody. We've got this photo here just to illustrate that an innovator might feel like they're doing 100 different things at once, juggling competing priorities, doing things that they would have never had to have dealt with or considered before. And I think particularly a lot of the people that join our programme might have very limited experience of setting up a business, for example, or considering legal implications of their innovation. So it's sort of approaching those unknown things that our programme sort of helps to connect people and to the right people and give them the right support to allow them to juggle all of that. And it's worth noting as well that you might think of an innovator as just being an entrepreneur, a sort of single person that's created a new idea, a new business, but you could also be an intrapreneur. So you could be somebody that's working for an established organisation and working within that organisation's framework and creating innovative practices, innovative processes within that. So that's something to bear in mind as well. If the team has anything to add, please feel free to jump in. But
so I suppose Tamsin is a great example, and she'll be able to share some more information on the skills and knowledge she's gained over later. But I think our entrepreneurs that have been on our program will understand you learn 100 different skills, sometimes all at once, that you didn't know you needed to know. So you might learn about how to structure, and they're all really useful skills for working in the workplace as well as being in starting up a company. So being an entrepreneur or a startup founder or developing a project might teach you about how to do things really leanly, or how to create budgets and profit and loss forecasts, and understanding what your finances are going to look at and how much money you need to earn to or create or need to develop that innovation. Might also teach you how to run a project. You need to know about marketing and comms. There's so many different skills that innovators will pick up and learn along the way from contacts, from their networks. Someone's just put in the chat how to write a business plan. So all of these skills are relevant in the workplace as well as in the startup world. So innovation sometimes is a bit of a word that people don't really know what it means or how it looks or what they need to do, but it's just a set of really different skills that, or not necessarily really different skills, a combination of different skills that enable you to develop that thing or product or service.
yeah, thank you, Polly. And so if you are somebody that's, thinking about innovating, but you're not sure where to start, but maybe you're a student and you are on placement in different clinical areas, maybe you are a member of staff working within the NHS, but haven't yet started innovating, it's a really good idea to sort of try and understand the current landscape of the NHS and, key areas for improvement, for developing, and key priorities that the government and NHS leaders are focusing on. And so we've got just a few examples here of sort of resources, documents that if you haven't looked at already, it's well worth a read of. So for example, in September 2024, an independent investigation of the NHS was a report was produced by Lord Darzi, and this was commissioned by the Secretary of State. And this did set out positives of the NHS, but the key focus of it was to identify sort of areas for improvement, to look at what needs to change. And I've listed some of them here. So people struggling to see their GP, long waiting lists for community services and mental health, A&E having to or struggling to meet sort of the required standard of care, waiting times for hospital procedures increasing, cancer care sort of compared with other countries, care for cardiovascular conditions, sort of wanting to progress that more. So it's well worth a read of that, just to give you a sort of an idea, an overview of some key areas for improvement, and innovation could take place within these areas. Another document that you could look at is the NHS 2025-26 Priorities and Operational Planning Guidance, and this was published in January 2025. So it just sets out for the year ahead from January sort of key priorities, key things that are being focused on. So, for example, reducing the time that people wait for elective care, improving A&E waiting times and ambulance response times, improving patients' access to general practice as well as to urgent dental care, improving patient flow through mental health crisis and acute pathways, and improving access to children and young people's mental health service. So again, it was really helpful just to pinpoint key areas for development. And as I say, innovation could take place in these areas in particular. And then, as you may have seen sort of in the media, in the coming weeks, it seems the new 10-year health plan will be published. It's also known as the long-term plan. The last one was published in 2019. And this just sets out sort of the vision for the next 10 years for the NHS. And prior to its publication, there's been a lot of talk about what might be involved, and there are key priority areas that it's thought might sort of underpin this plan, and those are to focus firstly on prevention, so moving away from the focus on sickness and instead putting a lot of effort into prevention, self-care, the management of long-term conditions. Another key priority is to sort of transition from relying on hospital care or secondary care and instead focus on the delivery of care in the community. And the third priority is this shift from analogue to digital within the NHS. So trying to implement digital ways of doing things. I don't know, team, if you want to add anything to that, but it's just worth, I suppose, understanding the current landscape in order for you to develop your innovation. Okay, thank you. I'll move on. So I thought what we'd do now is just have a look at some examples of innovations from our clinical entrepreneurs on our programme, just to, again, give you a bit of an idea of what innovation can look like, and specifically sort of looking at the problem that each clinical entrepreneur identified, and then the solution, i.e. the innovation that they have created in response or are developing in response to try and resolve that problem. And I'm not sure if any clinical entrepreneurs or patient entrepreneurs are on this call, but if you are, and in a few minutes time, if you want to share what you're working on, the problem you identified, and the solution you're coming up with, then you'd be more than welcome to. But I'll pass over to Tamsin, who, as mentioned, is not only our co-clinical lead for our programme, but also a clinical entrepreneur. And she can perhaps give us a bit of an insight into the problem she identified and her innovation. Thanks, Tamsin.
Oh, thanks. I just thought I would whip through what the process that I had gone through. I felt like I was working as a paediatrician and was coming up against problems that I was seeing. I ended up aligning it, like Jenny's just said about the 10-year plan. I ended up aligning it with waiting lists, and that's how I frame it now, around waiting lists and prevention, and also around community health, so moving it out from hospital care, from hospital into the community, which are priorities for the government. But that isn't really how I started, but I definitely frame it like that now. And also thinking about what Jenny said earlier about what does an innovator look like, I was told twice before I joined the clinical entrepreneur programme that I definitely didn't look like an innovator. So I don't know what an innovator looked like, but it didn't look like me for at least two people. And then I was also not sure, because at the time I was starting my innovation at the same time as the clinical entrepreneur programme was starting. And I didn't know if I was an entrepreneur. So yeah, I got all those things wrong at the beginning. So don't feel like, if you're worrying about the fact that you might not look like one, or if you are one, then you probably are. So I was simply working as a paediatrician, and I was worrying about the children that I was seeing in clinic, because I'd been asked to do my usual paediatric clinics, but I was also doing my a clinic that I'd been asked to cover around children who had hearing loss. And it's not like I was fast at coming to a conclusion, but I started seeing a pattern over about 10 years of some of the children that I was seeing in my paediatric clinics. So some of the kids who had attention problems or difficulties with speech or language or learning. So they would come to me with, do you think this child's got a neurodevelopmental problem or a learning difficulty or attention difficulty? And I would be looking into them, and for a proportion of those, they had the most common type of hearing loss for a period of time. So I don't know if any of you have come across it, but there is a condition called glue ear, which it just makes it can reduce your hearing for a period of time. And if it stays down, then you can go and have you can go through the NHS pathway, and eventually you might end up at a grommet operation. So all glue ear is that you've probably experienced it. It's just where you get a cough or a cold, and you or an ear infection actually, and afterwards you can get left with fluid or mucus that's built up behind your eardrum, so you can feel very congested, and that congestion makes it difficult for sound to go across to your inner ear, so it makes it difficult to hear. Now, as adults, if we've had that, we're okay, because we understand, we've developed our speech and language, we're not learning new words, we actually know how to read, we've done our phonics. But kids under 8 get this the most. Almost up to 30% of children in one classroom in primary school over winter months can be affected. So you can have a third of the classroom affected. And what happens to children is that they can't hear very well. So they're missing the small sounds within words, and they're not so good at learning new words. So their vocabulary goes down. Their reading becomes very challenging, because if you can't hear the difference between words, it's difficult to learn to read, and you definitely are struggling with spelling. So I was seeing that these children, who we have lots of, so many children have this, that when they do school hearing screening programs, so this is children who started school in the first year, 1 in 10 of them will have this, and everyone's like, oh, we were trying to find the ones with permanent hearing loss, and we keep finding the 1 in 10 who've got this, they're congested because they've had a recent cough or a cold. But actually, that 1 in 10 were the kids who were languishing at the bottom of the reading group and struggling. So it's incredibly common. So what do we do with those kids? We think that it might clear up on its own, which a lot of it does. Like 9 out of 10, they'll clear up within a year. And so what we do in the NHS is we say, oh, if you've got that condition, like, and you could go to your GP and you say, well, I don't think my kid's hearing very well, or the teacher is worried about it, then you go and have your first hearing test. And then there's a 3-month watchful waiting built in, not even just in the UK, in every single country I've currently come across. They also wait to see if the condition clears up on its own. And then they do another hearing test. So now you've waited, so you've got a kid who's maybe 4 years old, started school, who's now waited to get a first hearing test. Then they've gone, oh yes, you can't hear very well. Wait for another 3 months, have a second hearing test. Oh yeah, you still can't hear very well. Go and see an ear doctor, an ear surgeon, and then you wait and see them, and then they go, oh, you still can't hear very well. So then we'll go, and then we'll give you, we'll think about putting you on a grommet operation waiting list. And then the grommet operation waiting list before COVID was around 9 months in Cambridge. In Cambridge, we're doing pretty well with getting people through reasonably quickly. So in summary, children are left with a bit of a hearing loss for a year, even if they're trying to get an intervention. And if you are, well, you don't really have to be a paediatrician. You can, like, a year, if your kid is 4 or 5 or 6, is a really long time to leave a child with a hearing loss for. And I'm pretty sure if they couldn't see very well, we'd give them a pair of glasses. So for a year. So I was thinking we just need to do something really early on in this pathway, because children can't hear very well and they're waiting for quite an expensive grommet operation. So maybe we could just support their hearing earlier. It wasn't really rocket science, it was just kind of, maybe we should support their hearing earlier. Maybe I should do a research study which shows that if we put some sort of hearing support on them earlier, that they don't end up coming to a paediatric clinic later because they've got learning difficulties or speech and language difficulties. So that's the research study. I've never done research before, but I thought I'll go down that path, and I'll use the medical devices that are already in existence. And there was a lovely hearing aid that works really well in this condition but it was £3,000. And so all of my colleagues said, no, that's probably a complete waste of your time, because even if you do the research and you say, yeah, 1 in 10 children could do with that, who's got the money for a £3,000 hearing device for each of those children? So then I'm going to cut a long story very short and just tell you that then I put something together for 50 quid that did the same thing to support children in a classroom setting. They find it most difficult to hear over background noise, and they need to listen to the teacher above everything else. And so we make sure that there's a little microphone that can be worn by the teacher and a headset. This is what it is, which can be worn by the child. And over a very long period of time, that was researched to see if that was suitable. It was statistically significant, which is great. That's quite a challenge because I hadn't done research before. So I needed to learn a few skills around that. And then ended up doing that. So you've got children whose hearing can be supported with a £50 device. And also then there's 2 things I needed children to do. One was to hear, which they then can do with the device. And the second thing was that they needed them not to fall behind in their development. And so built an app that supports their speech and language skills and listening skills and make sure that they can hear quiet sounds within words. So there was 2 different things, just to make it really unusual. This headset was not considered in the end by the Medical Health Regulation Authority to be a medical device. So this actually is CE marked just more like a set of headphones. And the app that I've got is a medical device. So that's also something that people need to think about reasonably, need to be supported through the programme to consider about where you need what you need your research to show and how you're going to make sure that they're regulated in the right way. What happened to me was that once I'd published some research and got some studies that showed that this device was helpful, COVID happened, and then I was able to do the very first sort of opportunistic study, which was that they decided that all of the children, all of the grommet operations were not going to be supported. They couldn't prioritize them during COVID, so they stopped the grommet operations. So I had a solution. So we were able to post these in the post by 2 families who were waiting for a grommet operation as lockdown happened, and then give them details about the app. So I was able to show that they could be supported remotely. And in fact, what happened is that actually most of them, their glue cleared up. And so 3/4 of them didn't need a grommet operation. Only 1/4 went on to have a grommet operation. So that's a cost saving for the NHS. And that's why I frame all of those things in that context. For me, then what happened was these are £50 and that makes them low cost. And so low income countries were very interested because they didn't have access to hearing aids. So the really sad statistic is that 80% of all the children in the world who need some hearing support, 80% are not wearing anything. So all of those kids will end up they don't move out of poverty because they stay unable to hear and they can't access schoolwork, and then they don't get a job. So that led to work in predominantly Malawi, but today talking about doing the same thing in Rwanda. And so that led to a sort of global health interest and then some work with the World Health Organization. So that was a journey that I wasn't really expecting to be on at all, but has led me in a certain direction. And it's been a complete joy then to be able to support other people in their journeys, because it's so difficult to it's a difficult journey. It's quite a lonely journey, and you need a support. You can't do any of these things alone. You need a village to raise a child, and you need a CEP community to raise an innovation. And the amount of time it takes from idea to getting something out is quite long. So you need that time to develop not just your innovation, but some of the personal skills that you need to be able to speak to people about your innovation and get it to the right people in the right way. I've probably taken up too much time, Jenny. Sorry.
No, not at all. Thank you very much, Tamsin. If anybody does have any questions for Tamsin, please feel free to raise your hand or type it in the chat, and Polly or
There
Lucy
is a
will.
question in the chat that's asking, what stage were you at when you applied to the programme?
Oh, that is a good question. Yeah. So I thought that I was at quite a good stage, because I had put together some of the device. I hadn't got it out there, but I put together something that could work. But I'd shoddily put together some bits. When you first put together something that you think is your first prototype, it's pretty ugly, and mine was no exception to that. So I had my first device, and then the bits that I was using, some of them stopped being available on the market. COVID also closed companies, and they closed companies that were supplying me with bits, or could with at the time were just bits really. I was, when I applied, I had tried to do lots with tiny amounts of funding from a charity. I had a device that I had sort of put together, but it definitely wasn't something that could be used. It wasn't out there. Now there's a product that is on sale, but there wasn't anything like that at the time. I was just putting together the app at the time, and I probably should have joined the network earlier. I should have joined the Clinical Entrepreneur Program earlier, because I was making some mistakes that I didn't know about. And I was probably feeling lonelier in the process, because when you're doing something outside the NHS, everybody inside the NHS wants you to just keep seeing patients. So they want you to stop faffing about with anything that looks different and is taking up, or they perceive might be taking up time. So it felt like there was very little support. But again, once you are a clinical entrepreneur and you can talk to people about being on the program, and you can talk to your medical director or whoever it is who's your line manager, there's some people can start thinking about what you're doing in a different way, and seeing it maybe as a valid option. So I joined reasonably early, and I should have joined earlier probably.
There's another question, Tamsin. I've just got to find it, which was, has glue ear increased in the last few years? What causes it? Was it common in the past? Is it pollution? I was just wondering what or if new factors are causing this in such a high percentage of children.
Such a good question. And I actually have been reading about this in the last week, because it does appear to be going up. And you're right that air pollution makes a big difference. Vaccines improve it, so they get better. So some of the vaccines that we use, so countries that don't have vaccines have a higher rate of glue ear. Children who are malnourished get more glue ear. Children who are around smoke get more glue ear, and children who attend nursery for more than 3 days a week, and children who are more than the third in the family. And I think the nursery thing, and then being part of a bigger family, is that you're just around lots of viruses. And if anyone's got children, then you'll know that they get coughs and colds the whole time. They're like a little petri dish. So they just pick up everything at that point. Why is it increasing? And I think that you're right with the air pollution. They don't understand why. They've done a load of research, particularly in Australia, because Australia is really interesting. And you've got the Aboriginal population, or the indigenous population, who have a really high incidence of glue ear, living alongside the Australian population, who have sort of the 1 in 10 glue ear. So they're trying to work out why that is, and they think that there's just some susceptibility that they haven't worked out. There is a tiny genetic component to it, but it's very small. It doesn't quite fit. And you'd hope that maybe with less smoking it would be better, but then we've got more air pollution, and we've got more particulates matter in the air. So I think you are quite right about raising that. Brilliant. Sounds like you maybe are a paediatrician or an audiologist or something, or maybe not, maybe a budding one.
And we also have a hand up from Kwame. Kwame, do you want to unmute and ask a question?
Yes, thank you very much, Dr. Thompson, for sharing this inspiring project that you have you started with CEP, and it has actually come fruition, and it is solving real life problems. My question that I have is, when you were starting with the here glue ear, did you started from the point of view of the larger global community access, or you started by looking at UK specific? The reason why I'm asking is my one that I actually presented the last cohort, but it actually didn't become successful, which I'm going to apply again. It is bordering on the line of it being useful in the UK and also useful in other parts of the world. So I wanted to know how, when I'm applying, what should be my main focus before I branch out. So that's my question.
Well, mate, I love it. And I'm going to ask you about your thing, because that sounds amazing. And I love that you're back on here, and I love the resilience. It's exactly the resilience that you need for an innovator. So fantastic. Love that you're here and then applying again. Brilliant. Yeah, do you know what? I think I was just not as knowledgeable as you. So I couldn't possibly have thought big enough. I was thinking about my own NHS patients at the time, and it was quite UK based. Actually, I do think that starting small is more manageable. So for me, it was more manageable to do that. And I am still working on a collaboration so that it has better features and is more, there's always things that you want to improve. You know, there's so many things I want to improve on that app. That I'm almost a little bit embarrassed that it hasn't got those things at the moment. So I started small, and I think that I couldn't have done it any bigger at the time, because it needed to be small and manageable. And I think at the time that was a mistake from me, because I just didn't see it as being something that might step outside the UK, you know. But tell us very quickly about your app, because you were on here, and I think we should all know about it, because it sounds like you thought it through better than me.
My idea is actually in stages, but my background is I'm a clinical pharmacist, and on the other side as well, I'm actually starting my public health degree. And on the other side as well, I'm a health content creator / podcaster. And my content is basically focused on mental health. One thing I realized from my interaction, my advocacy, where I started from, I realized that mental health education is one of the major contributors to stigmatism surrounding mental health, especially from the community I'm coming from. I have had a lot of instances whereby people are constantly being presented with a mental health condition, but they don't want to talk about it in the general household. And is one thing I found out was not because they don't want to talk about it. Everybody's looking for solutions, but is majorly because they don't really understand what it's all about. Therefore, education has been a massive gap. So I realized that one of the ways that I can incorporate within my project was trying to use our own language or different languages to be able to speak to people whereby content are being created, because I already create content on different mental health conditions and I release it on my YouTube channel. So I realized that if I am going to help with innovation, which mental health, everybody recognizes it, then explaining it in a language and in much simpler terms, which I already doing on my project, on my content, would help people to be able to understand and be able to get access to that information, so they will know how to be able to see early symptoms and signs and get to help people earlier. And on the flip side of it, I'm actually creating an app form called PharmaChat. So if mental health education is a problem and people find it very difficult accessing it, one of the other things I also realized was that in terms of access to medication, especially in Africa as a continent, I'm from Ghana, by the way. I
Mm.
realized that it was becoming very difficult, whereby people could get access to medication and also get access to people's clinical information. So, in terms of even prescribing medication or trying to get people's background in terms of what they are taking already, it's become a big issue. So, trying to fuse um education about conditions and being able to have the information about the patient in the hindsight and be able to prescribe the right medication has been a very big barrier over a longer period of time, and unfortunately it has led to misdiagnosis in a lot of people growing up and unfortunately see them die. So I realized to merge this kind of different sectors of healthcare to be able to help one, get access to medication easier, two, medicine management easier, three, health education easier on one particular platform. So it's not like it's being treated in silos, but all of them are being
Mm.
targeted holistically and be able to give a better patient care. So that is what my idea is about.
And are you is it all right if I keep going, Jenny? Is that all right? Can I ask? Can I comment? I just desperately want to know now. So they would access your thing for your app, and they would
Yes.
get information about pharmaceuticals, but the mental health is just like on the side. That's something
Providing
that
like mental health is so mental health is actually my starting point with public health education.
right.
Because that's also a massive gap. So instead of they trying, because most of the time I believe a lot of your patients comes to you and they may come with a condition. They'll be like, oh, is there any video or is there anything I can
Yeah.
get access to? So through my app that I have already, there are already certified videos that's been created by healthcare professionals like myself, which can easily break down the condition and the side effects and everything after they've had a consultation, because consultation, 10 minutes consultation, is not enough for them to be able to ask all the questions. But through that video that has been created by healthcare professionals and certified, they'll be able to get access on a platform that has been verified and certified. So it's not like they are getting the information wrong from someone, but it's also helping to tackle misinformation that we are facing right now in healthcare.
And it sounds like you have, like, it's quite an interesting thing to put together, and that's really exciting to put both of those things together. What made you come up with it?
What made me come up with it is I have actually seen how misinformation and the lack of accurate information is doing more harm within my community than any other thing I've actually seen. It's making people feel like they know more about a condition and be able to give their idea. Meanwhile, it's not. A brief hindsight was when my friend was diagnosed with mental health condition. Initially, no one knew what was going on. So people even thought it was a headache, and people came up with suggestions like she needs to take paracetamol and stuff. And this is here in the UK, not even in Ghana or any other country. So this actually made me feel scared that what exactly is going on and how are other people who are not getting access to information in other parts of the country or even other parts of the world, how is mental health being treated? And recently as well, someone I know, the mom told her to stop taking their medication, which they've been prescribed for their schizophrenia, because they have different understanding of what the medication is going to do. And me being a pharmacist and understands the importance of the medication in managing this particular condition, it made me feel scared that misinformation is really eating and doing more harm to people than the actual condition. So that is one of the sides that I'm actually looking at, which I'm part of, YouTube Health Creators, to make sure that we end up break that kind of barrier down.
Amazing. Polly's going to dive in. Oh, it's great, Kwame. Yeah, look, you've got people sending emojis to you, and well done. And it's great that you have such a strong why. You have such a strong reason behind why you want to do it, because it's got to see you through, which you clearly do. And there's quite a lot that about global health that that would be very relevant there, and how you connect patients. So one of the things that there's a different company, they don't do anything to do with health particularly, but they use thumbprint so that people don't have to be able to write, or if names change. So they might be someone who you might want to consider speaking to or collaborate with. They collaborate with lots of different innovators. Polly's going to give you some advice.
Firstly, Kwame, I just wanted to say last year was our most competitive year yet. I always liken the clinical entrepreneur program to the X Factor. You know, you reached when the X Factor was at its prime, you reached a bit of a plateau, and you didn't get anyone that was really outstanding, and it sort of slowly died a death. It's not like that on the clinical entrepreneur program. Every year we get better applications. I thought we might hit a bit of a plateau, but we haven't yet. So last year was just we had the most applications we've ever had. They were really, really high standard. So obviously that involved us doing some more discerning selection. So I would say, listening to you though, you've got a really interesting proposition there. And with the move as one of the NHS priorities from illness to prevention, health literacy is really, really important, and educating the population on looking after themselves firstly, and any conditions they might have, will become more and more relevant. So I would say just stick with it. Please do reapply. If anyone's on the call that didn't get on last year, please do reapply. We often have lots of clinical entrepreneurs that don't get on first time, and they keep going and they do get on. So just think about, it might be worth thinking about what you applied with last year and re-looking at your application and see where you can improve on some of the questions that were asked. And obviously, I would assume from your application to this point now, your ideas develop further. So that's always a positive that you're still working on it. So yeah, thank you for that. For that description and conversation just now.
Thank you very much.
Kwame, I don't know if your 1 minute pitch, but when you're doing, so one of the things that I did wrong was that the 1 minute pitch is really difficult to get your ideas into, isn't it? Into 1 minute. And so I was so unhappy about doing a 1 minute pitch that I felt like mine didn't belong. I didn't follow the rules because I had both a device and an app, and so I couldn't possibly get it into 1 minute. I have to say that once I got that bit better, and once I got it into a minute where I could actually put it across in 1 minute, then several things happened for me, not just the clinical entrepreneur program, but once I had understood that, so I think really condensing it into the 1 minute and getting across the statistics about why it's important, alongside the share it. Tony talks about winning hearts and minds, so you need to share something. One of those stories that you shared, where about I've seen the problem, I've felt the problem, I understand it, together with here are the statistics, this is why we must do it, is really, it makes a really powerful story. And sometimes making your story as good as it can be is just something. So as soon as I had developed my 1 minute pitch, which to be honest I didn't quite get right until I was on the program, and then I started really honing it down, and then I actually ended up doing a 1 minute pitch to somebody in the bathroom, washing hands in a toilet, and that person happened to be a Silicon Valley giant. And so but if I hadn't have been able to do it in 1 minute, I couldn't have done it within the time it took to wash your hands. And it just happened that the person that was talking to was really important for how the next thing. And I got then the people who I now work with on the product who put it on their shelves. So that 1 minute pitch bit, work on how brilliantly you put across your story, which you must be brilliant at anyway, because you do podcasts and things, but it's hard, isn't it? Anyway, I just thought I'd mention it because it's something that I found difficult. And if other people are finding it difficult, it's good to just think about how you can put all of those things across in 1 minute. It's tough, but it's kind of worth doing as an activity.
Thank you, Tamsin, and thank you so much, Kwame, for sharing all of that. Thank you. We will, our sort of fourth session of this webinar series will look at pitching, actually, and we have a speaker who will sort of give you some tips and ideas for how you can make your pitch as sort of direct and appealing as possible to relevant people. So just to, I'm not sure if there's any more questions in the chat, but I'll move on for now. And then if there's time at the end, please feel free to ask some more questions. But for the purpose of sort of highlighting how broad innovation can be and what innovation can look like, we've just got a few more examples, sort of summaries of clinical entrepreneurs, the problems that they have identified, and the solutions, i.e. the innovations that they have created in response. Now, these are just very brief summaries, and I will stress that if you take a look at our website, I'll pop the email website address up in a moment, the full sort of case studies and entrepreneur profiles are on our website for you to read in more detail, but hopefully this will just give you a bit of inspiration and just a bit of an insight into how diverse innovation can be, and the fact that we have entrepreneurs working in all different fields. So the first example I have here is for a clinical entrepreneur called Corinne Birch, who is an advanced physiotherapy practitioner in primary care. And the problem that she identified and sort of brought to our programme alongside her innovation is that within the NHS, hip and fragility fractures cost around £4.4 billion per year. And at the moment, interventions are only put in place after someone has already had that fall and that fracture. So in response to this problem, Corinne is developing an automated digital screening process that really pinpoints the older adults who are at the highest risk of having those falls and fractures. And the aim is to prevent it from happening in the first place, reducing disability, and thereby improving the health of these older adults. So it's all about putting in place personalised intervention once those adults have been identified. So this is just another example. We also have Dr. Frances Duffy, who is a clinical entrepreneur on our programme, a consultant clinical psychologist, and actually she has worked for Health and Social Care in Northern Ireland. So she's one of our sort of small group of clinical entrepreneurs from Northern Ireland that we incorporate into our main cohort every year. And the problem that she has focused on is that people who are experiencing dementia frequently experience distress or exhibit behaviour that can be really challenging for caregivers to understand, and it can result in a complete breakdown in their living arrangements, or it can result in them being admitted to hospital. So in response to this, Frances has actually developed a series of innovations over time, which all sort of serve to raise awareness of what dementia is and to increase and improve people's understanding from the perspective of the person who is living with dementia. So, for example, she created something called Clear Dementia Care, which is an assessment process to try and sort of identify the contributing factors that are leading to this distressed behaviour, so that those unmet needs can be met and interventions can be put in place. Frances also developed an app which provides information about dementia, the different types, what behaviour might look like. She developed an AI platform which uses smart sensors, apps and devices to model the daily routine of someone living with dementia. And then by analysing it and training this AI model, it's possible to sort of pinpoint the events and activities that take place immediately before the person experiences distress. The idea being that interventions can be put in place to reduce or mitigate that distress. And then finally, she has created this 6D dementia training platform, which offers accessible, comprehensive training for caregivers and healthcare professionals. So, this is another area, another field of healthcare that she is innovating in. Another example here is a GP called Dr. Angus Perry. And the problem that he identified is that GP practices often have very different ways of working. And in particular, when onboarding a new member of staff, he noticed that the practice for this is different across different GP practices. And there's often a reliance on sort of paper information packs. So in response to this, Angus Perry created a digital hub called General Practice AI, which simplifies that onboarding experience, puts all the key information in one place, can be updated easily, can be more accessible. And by then going on to integrate this with AI, the hub has evolved into an assistant that sort of helps with everyday GP practice tasks like writing referral letters, creating exercise prescriptions, and developing mental health plans. So this is another type of innovation and in a different area. And another example, sorry, I'm whizzing through these quite quickly. Neil Stevens is a clinical entrepreneur on our programme. He is an innovative management consultant and a healthcare researcher. Now, the problem that he and his team at Predictive Health Intelligence identified was that liver disease often progresses silently and patients don't necessarily show any symptoms until the disease has advanced significantly. And traditional detection methods rely on that presentation of symptoms, which often means it's too late for any effective intervention. So in response to that, he and his team have created a case-finding search engine that empowers clinicians to use existing data to identify patients who are really at risk of developing liver disease. And the idea is that this will lead to early diagnosis and proactive management. So that's another example. And then finally, Dr. Saif Ahmed is an academic consultant clinical oncologist, and he is the co-founder of a company called 52 North. And the problem that he and his team identified is that patients who are undergoing chemotherapy can develop neutropenic sepsis, which can be managed effectively if a patient is in hospital. But if that patient is at home and has even mild signs of an infection, like a temperature, the guidelines state that that individual has to come into hospital to be tested, which can take a lot of time. And while waiting for those results, they're given intravenous antibiotics as a precaution, but in 1 in 2 cases, that isn't necessary. So in response to this problem, NutriCheck was created, which is a low-cost finger prick blood test and a digital platform, and it provides quick, reliable results at home and allows doctors to identify those patients undergoing chemotherapy who are at risk of this sepsis. So I'm sorry if I've gone through that very quickly, but those are just a few examples. And as I said, please do take a look at our website. The address is there. We have a whole number of case studies, a whole number of entrepreneur profiles where you can read about those particular examples and many others in more detail. So hopefully, I find it's very inspiring to read all those different, to see the different work that people are doing and the ideas that they are developing. I'm not sure if the team wants to add anything before I move on, or if anyone has put any questions or anything in the chat.
There's no questions in the chat at the moment, Jenny.
Okay, thank you. If as I said before, if there is anybody like Kwame who is developing an innovation already and wants to share what the problem is they've identified and what they're working on in response, please do feel free to raise your hand, and you're welcome to do that at the end as well. So just to move on, I thought we'd sort of open it up and so it's not just us talking all of the time. But I wondered if all of you on this call could perhaps reflect on examples of innovation in healthcare settings that you might have come across. Now, I'm aware that some of you are working within healthcare settings full time. Some of you are students, so you've just had a bit of a taster, a few placements perhaps in different settings. And perhaps this is something you can take away with you, just to think about whether there's any brilliant innovative practice that you've already come across, and in turn to think about what problem that innovative practice has addressed. I'm not sure if anybody can think of anything immediately. If you can, please do feel free to write it down in the chat, or please feel free to raise your hand. But it's sort of like that developing of an innovative mindset, sort of looking out for examples of innovation that are around you in your workplaces or your student placements, and thinking about what is working well and what problem that innovation addresses. I don't think anybody's writing anything in the chat, but if you can think of anything and want to share it, please do feel free. And the other thing I thought we could think about is, although we've looked at some examples of innovation, we talked about some examples, but what is it that really makes these innovations successful, or what would make an innovation successful? What are those key qualities? And next week, next Thursday, in our next session, we'll be looking at sort of idea generation, coming up with some innovative ideas and how we might develop those. But underpinning all of it, I wonder what the key qualities might be. And this could be something for you to go away and think about, but just a few ideas. So innovations, we would say, have to have that novelty. They bring a fresh perspective, which leads to a sort of breakthrough in patient care, might be in disease management, or perhaps it's operational efficiency. And so it really drives progress, the fact that there is that novelty. Another quality is the value of the innovation. So healthcare innovation should have value in that they should improve patient outcomes, perhaps enhance quality of life, reduce costs, perhaps streamline processes. And when stakeholders recognise that there is clear value, they will be more likely, of course, to adopt and support that innovation. Another key quality is scalability. So it's worth thinking about how and whether an innovation has the ability to expand in its impact. So that could be across a broader population of people. It could be across multiple healthcare settings. And those innovations that can be replicated, adapted, implemented at scale may be more likely to succeed. But of course, assessing this is in itself a difficulty. And also empowerment is a key quality. So thinking about who your innovation might empower. So would it empower patients, healthcare providers, other stakeholders? Would it enable patients to have more control over sort of decision making for their care, or to manage chronic conditions? Would it allow them to access more information to lead to better health outcomes? And also empowering the healthcare professionals who are using the innovation and equipping them with that tools, data, training will in turn enhance their effectiveness. And finally, synergy is a really key quality of a successful healthcare innovation. So thinking about how the innovation sits within a broader sort of ecosystem, so how it collaborates with different stakeholders, so researchers, clinicians, policymakers, patients, industry partners, sort of combining expertise, resources, and perspectives, really creates that ecosystem and would accelerate progress. I'm not sure if anybody has any questions. Rest of the team, please feel free to let me know if they have. But I think unless anybody from the team has anything to add, I think we'll sort of start to wrap up there. So I'm not sure if anyone joining us has any questions or anything they want to share. As I said before, if you have an innovation and you'd like to share what problem that's addressing and what you're doing in response, that would be fantastic. I'm not sure if there's anything in the chat. Have a look. No? If you do have a question, please feel free to raise your hand or pop a message in the chat.
There's a couple of raised hands. Let me just see. And Sarah.
Hi there. Thank you so much for this. It's very interesting to see what's happening, really. I did go to the sorry, the other event last week, and it was wonderful. I'm studying in September at the Royal College of Art, a course called Information Experience Design, and it's amazing because I'll have the usage of so much technology, especially VR and AR, and I'm hoping to find different and new ways to be able to bring experiences to those less fortunate and who can't do them anymore. My sister-in-law has MS, and she no longer has ability to move her legs, and she's only 30. And so it would be beautiful to bring her experiences that she can't go to anymore, like so many other things that she wishes she could do and run and play. Maybe I can bring that to her. So that's kind of my idea along those lines.
Amazing. Thank you so much for sharing. I think it was Salma that said that? Sorry if I've got the wrong person, but thank you so much for sharing that. And it sounds like you have a real understanding of the problem through that first-hand experience. And as mentioned before, actually, we do have on our programme a cohort of patient entrepreneurs who are people who have lived experience of a particular health condition, whether that's as themselves or through caring for somebody close to them. They also sort of benefit from developing their innovation on our programme. So yeah, thank you so much for sharing. I'm not sure if anybody from the team wanted to add anything.
We have a smaller patient entrepreneur cohort, don't we? So it is at the moment it's only been going for a couple of years, and so it's slightly more restricted at the moment. But we've benefited so massively from having patient entrepreneurs for multiple different reasons. They're such an important part of the cohort. So yeah, it's just that it was quite a small cohort initially, so it makes it. We're looking for sort of slightly more mature innovations. Is that right, Lucy, for the patients?
Yes, Salma, just thank you so much for sharing that, by the way. That is really beautiful thing to do. We do have a couple of entrepreneurs, if you are interested, that I might just connect you with if you want to kind of explore this a little bit further. I can point them out on LinkedIn to you. That's fine. But also the patient entrepreneur program, as Tamsin said, it is a smaller cohort, so we do support patients with innovative ideas to improve a health condition that they or some of their care for is experiencing. And we do that with the patient and public involvement team at NHS England. So we give additional support to those patients because we understand sharing that story, developing that idea is more personal. So we do have that program, and if you want to sign up to our newsletter, we can let you know when applications do reopen for that, and that basically sits alongside the CEP, so you have all the support of the normal program. You get to interact with all of our clinical entrepreneurs, but also we provide that wraparound support for you. So if that's something that you're interested in, please just reach out to us and we can make sure that you get all that information that you require. Thank you so much for sharing. Appreciate that.
Thank you so much.
I'm not sure if anybody else has any questions or anything they'd like to share. I know there's a few comments in the chat, so if anybody would like to unmute to share it out loud, please feel free.
There's no actual sort of questions in the chat, Jenny. There's lots of people talking about what they're doing in the chat though, which is great. So thank you. Alexandru shared a link to his innovation that he's working on, but he can't unmute at the moment, and some people are having some mic issues. So there's no actual questions there, but thank you for sharing all of that with us.
Yeah,
Great.
thank you everybody. And as mentioned, next week we will be looking at sort of idea generation and developing existing ideas people have, or if you're coming to this without an innovative idea, then hopefully this will be an opportunity for you to come up with one and explore sort of problem areas that might inspire a particular innovation. But unless anybody has any questions, we might end it there. But you can see our email address and our website is hopefully showing on the screen for you. So please do get in touch between now and next week, or save any questions for next week. But yes, thank you everybody for joining. Thank you.
Thanks, everyone. See you next week.